CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the Secretary, global flu sample submissions have dropped by 60%, and COVID samples by 70%, leaving us with far less visibility into what's coming. At the same time, moving experts on birth defects and chronic disease out of CDC will fragment our response capacity. We learned during Zika, and more recently with Oropouche, that reproductive health expertise was essential in these complex infectious diseases causing birth defects. Due to the Secretary's actions, our nation is on track to see drastic increases in preventable diseases and declines in health.
I am so damn tired of being lied to. I don't think I can deny it anymore. You can stick to your story if you think it flies, but I'm not gonna buy it anymore.
Hello, my friends, and thank you for listening to the 325th episode of Congressional Dish. I'm your host, Jennifer Briney. And today's episode is a bit of a mea culpa, but also a sprinkle of hope. Now, this episode is a mea culpa because at the end of 2024, after President Trump was elected for the second time, I was looking for any possible silver lining because, quite frankly, I was not excited of returning to 4 more years of having to pay attention to daily Trump chaos, and I needed to see some kind of bright side. The direction that I looked for some kind of light was in the direction of Ronald F. Kennedy Jr., because I have long been concerned about the chemicals in our air, water, and food. And because he was an environmental lawyer, I thought he might be able to do some good in this area when he became Health and Human Services Secretary. Also around that time, Congress had held a few hearings about our food, and RFK Jr. was a witness in one of them. And so I created a few episodes about those hearings. But now that we have endured 10 months of the second Trump administration, and RFK Jr. has had almost that much time to either renew my faith as Health and Human Services Secretary or force me to publicly apologize for having any faith in him, well, after watching a recent hearing in the Senate about RFK Jr.'s behavior as Health and Human Services Secretary, I think it's time for me to say that I was wrong about him. Because there was a hearing in September during which we heard from Dr. Susan Menares, who was recently fired after less than a month as the director of the Centers for Disease Control, and I was shocked by the events that led up to her firing. Also testifying was Deborah Horry, who until recently was the chief medical officer at the Centers for Disease Control, and she recently resigned because of what she witnessed under the leadership of RFK Jr. And today I'm going to cut the fluff out of that hearing and let you hear for yourself the testimony that is forcing me to say I was wrong. Robert F. Kennedy Jr. is a terrible Health and Human Services Secretary, and I think he's putting American lives in danger. But this is also where I'm finding some hope, because the testimony you are going to hear today was solicited by a Senate committee, a committee controlled by Republicans. This hearing was the first real oversight hearing that I've seen this year conducted by the Republicans in charge. This is the first real examination I've seen of the Trump administration in this Congress. It's very late, but it's finally happening. And since an oversight door is now open, I see an opportunity for us to kick that door down. But first, we have to see the door. But before I show it to you, I want to thank you for listening because I know the amount of bad news is overwhelming right now. And I'm really grateful that you are taking the time to learn what's happening in Congress. Because Congress has the power to stop this chaos. Congress is our way out of this. But we can't pressure Congress if we don't know what they're doing or not doing and why. And so thank you for staying engaged. Because I know how tempting it is to turn it all off right now. Honestly, that's what I want to do. Some days I sit down to work on this show and I think, what's the point? But then I remember that you are the point. I remember that you can't act on information that I don't share with you. I remember that this show and this community existing is helping in ways that I can't understand because I don't know who's listening. But here and there, I find out that a CEO of a huge corporation is a fan of this show. I find out that a member of Congress listens regularly. I find out that members of Congress's staff listen to this show. I find out that the communications director at C-SPAN listens. And I find out that other journalists listen, and they spread the word. I know we are making a difference by sharing this information, even if I don't know the scale. But it's something, and that's the point. Congressional Dish existing is how I can help in these crazy times. And by helping me, you are making a difference too. So please support Congressional Dish, because we have been losing support lately. And the cancellations have come with kind apologies from people who are either hurting financially and need to stop paying for a while, and I get it. Especially our federal workers who are not being paid right now. I get it. I have no hard feelings. But we are also losing support from people who just can't take it anymore and who are giving up. And I'm genuinely sad to see those messages, even though I understand them too. I know things are dark. I know Congress seems useless right now. I'm as frustrated as anyone. But Congress remains our branch of government. Congress remains a powerful branch of government that has power to stop the Trump administration's lawlessness and recklessness. Congress has the power to remove Trump from office, especially now that he's murdering people at sea on a regular basis. High crimes and misdemeanors have been committed. And our system is still working as designed. Congress still has power. We just have people in charge of it that are choosing not to use that power. But we should still have hope in Congress. We should still be interacting with and pressuring Congress. We need to focus on Congress because that's where our power lies, which means I need you to help me keep going, to help me share as much information about Congress as I can, so that we can look for the opportunities for progress where I can find them, which this episode will do today. So please don't abandon this project now. You can support the show regularly with Patreon or PayPal or Zelle or Venmos or paper checks, but the point is that we need your support. Now is not the time to quit. And so thank you again for listening. I really do appreciate you. And if you appreciate my work, please show it by paying something. It really does help this show keep going. And so let's take a look into the door that I see opening for oversight of the Trump administration in Congress. Because like I said before, and I cannot emphasize this enough, this investigation was launched by a Republican senator, the chair of the Senate Health, Education, Labor, and Pensions Committee, Senator Bill Cassidy of Louisiana. And here's part of his opening statement in the hearing on September 17th, explaining his personal interest in what is happening at the Centers for Disease Control, otherwise known as the CDC.
As a doctor who treated children and families for over 25 years, I have the absolute obligation to do the best I can for the health of those whom I am entrusted to serve. In this case, I am, but we all are, entrusted to serve the moms and dads, their children, their parents, so that when I or any doctor makes a recommendation to provide a life-saving vaccine or treatment, they can reliably rely upon CD guidance. If doctors do not have clear guidance or have a reason to distrust what's coming out of the CDC, they cannot make informed decisions to protect their patients.
And here's why he called this particular hearing to order.
I am focused on the fact that Dr. Monarez was the first CDC director requiring Senate confirmation. We Republicans supported making the CDC director Senate confirmed. It's such an important position that we demanded a role in her or his choosing. And so part of our responsibility today is to ask ourselves, if someone is fired 29 days after every Republican votes for her, the Senate confirms her, the secretary said in her swearing in that she has, quote, unimpeachable scientific credentials, and the president called her an incredible mother and dedicated public servant, like, what happened? Did we fail? Was there something we should have done differently?
And so to find out the circumstances behind her firing, he asked Dr. Susan Monarez to testify. And here's what she said happened.
My name is Susan Monarez, and I am a microbiologist and immunologist. Exactly 12 weeks ago, in this same room, I testified that if confirmed, I would lead the CDC to restore public trust, modernize public health infrastructure, and strengthen the agency's core mission of protecting Americans from infectious diseases and emerging threats. I was honored to be nominated by President Trump and confirmed with the Senate's support.
And she was supported by RFK Jr. Here's RFK Jr. at her swearing-in ceremony on August 6th.
I'm very happy to have Dr. Manari's aboard. She comes to us from ARPA-H. She's a tech genius, and she's going to drive AI and modernize CDC's data systems. And we're going to be able to provide first-class information, gold standard science to the American people. Susan is an expert in public health, and I'm confident that she will do everything that she can to restore the integrity of this agency.
But that support didn't last for long. So back to Dr. Monarez. And in this testimony, you're going to hear her refer to the ACIP, which is an acronym for Advisory Committee on Immunization Practices, which is a group of experts that advises the Centers for Disease Control and provides recommendations on the use of vaccines. And you should know that on June 9th, Secretary Kennedy fired all 17 members of the ACIP and appointed new members over the next couple of weeks. Now, usually members would be rotated off of the committee and replaced via an approximately 2-year-long application process, which is led by a steering committee. And then the HHS Secretary, which is the position RFK Jr. has now, that secretary usually gets the final say on the appointees that the steering committee vets and recommends. It is not normal for the Advisory Committee on Immunization Practices to be fired en masse and replaced unilaterally by the HHS Secretary alone. And yet that's what just happened. And so, with that in mind, here's Dr. Susan Monarez.
My tenure as CDC director lasted 29 days. Since my removal, several explanations have been offered: that I told the secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened. On the morning of August 25th, Secretary Kennedy demanded 2 things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed.
And later in the hearing, Republican Senator Susan Collins of Maine asked for more details about that meeting.
When you met with him on August 25th, you have testified that he asked you to approve the recommendations of the new members of the committee, regardless of what they were. Is that correct?
That is correct.
So Secretary Kennedy, in testimony before the Finance Committee, has denied asking you to do that. Is there any doubt? Could you describe the discussion that you had on that issue?
Yeah, I'm happy to. The secretary in that morning meeting was very upset, very animated, and he said, with regard to that particular topic, I have heard that you may not sign off on the forthcoming ACIP recommendations. And I said, I cannot sign off on something before I see the data and the evidence. And he said, and elaborated on this for some period of time, that there is no data and evidence, there is no science, that CDC has never collected the data, the evidence, and the science associated with the safety and efficacy of the vaccines, and that I needed to commit to signing off on each and every one of those recommendations. And if I could not commit to that, I needed to resign.
And then Senator Maggie Hassan of New Hampshire wanted to know more about this meeting, too.
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
Yeah, it was, this is when he stated that CDC had not collected the data or the science. There was no scientific evidence associated with these vaccines. He said that CDC had failed in its duties to be able to appropriately evaluate the safety, the efficacy, never had conducted controlled clinical trials, placebo-controlled clinical trials associated with the vaccines. He made another set of assertions associated with CDC that were particularly pointed and particularly hurtful and disparaging. He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry. He said CDC forced people to wear masks and social distance like a dictatorship. And the one I think that hurt me the most was a particularly vivid phrase he said during the COVID outbreak. CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
And it is fair to say, in your view, that those statements are not true.
Those statements are not true.
Thank you.
I told the secretary that if he believed he could not trust me, he could fire me. The next day, I was told I still had my job, but the secretary's expectations remained: approval of ACIP recommendations and dismissal of career scientists. I would not commit to that, and I believe it is the true reason I was fired.
And about 2 weeks prior to this testimony, because she had made these accusations way before this hearing, but Secretary of Health and Human Services RFK Jr. was asked about these accusations during a Senate Finance Committee hearing, as Senator Collins just alluded to. And here is what he said in that hearing. Here's Senator Ron Wyden of Oregon. He's the one asking the questions of RFK Jr.
Did you, in fact, do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence?
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay.
So he says she's a liar and denied having a single private meeting with her. And so I guess you're just going to have to decide who you believe, because this is what Dr. Monarez told Congress. Here's Chairman Bill Cassidy of Louisiana speaking to Dr. Monarez.
And how many meetings were around the period of the 25th?
We had 3 distinct meetings that day.
Okay. And what did he tell you to do?
In the first meeting, briefly, in the first meeting, he asked me to commit to firing scientists or resign. He asked me to pre-commit to signing off on each and one of the forthcoming ACIP recommendations, regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have a foreshadowing of what they would be?
I did not. We did not get into any substance about what those...
He wanted you to approve them.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign. I did not resign, and that is when he told me he had already spoken to the White House about having me removed.
Did he ever communicate he was going to change the childhood vaccination schedule?
Not until that very day. In that morning meeting, he said that the childhood vaccine schedule would be changing starting in September, and I needed to be on board with it.
Did he ever suggest that that he was speaking for the president?
In that morning meeting, he did say that he had spoken to the president. He spoke to the president every day about changing the childhood vaccine schedule.
Okay. Did Secretary Kennedy ask you to speak to anybody outside of HHS?
He did. In the second meeting that day, he indicated that one of his colleagues or collaborators, I don't know what the relationship is, was coming into town the following week, and he wanted me to meet with that person.
Who was that person?
The person was named Aaron Siri.
Aaron Siri, is he the trial attorney who wanted to get rid of the polio vaccine allegedly, and President Trump slapped him down and said he couldn't do that? Is that the same Aaron Siri?
I don't know the second part of that, but I do know that there were public reports that he is the individual who had suggested getting rid of the polio vaccine.
Okay. I would now request unanimous consent to submit a article for the record. Dr. Menarez told us that Secretary Kennedy urged her to speak to Aaron Siri, and this article says, the title is, Anti-Vaccine Group with Ties to RFK Jr. Saw Another Windfall Last Year, Record Show, and it points out that $6 million was paid to his law firm to pursue public records requests, et cetera, and $20 million at times past. Secretary Kennedy has been an advisor to this law firm in the past.
And I read that article. It's available for you in the show notes, of course. But what did Aaron Siri do with the $20 million paid to his law firm? Well, he petitioned the government to pause or revoke vaccines, including the polio vaccine. And while Senator Cassidy, again, a Republican, seems to be concerned by Aaron Siri being paraded around the CDC as a trusted source of information, you should know that another Republican-controlled Senate committee, the Senate Homeland Security Committee Subcommittee on Investigations, which is chaired by Senator Ron Johnson, well, they called Aaron Siri as an expert witness on vaccines just 1 week prior to this hearing. So Republicans are not on the same page. But back to what happened to Dr. Menarez. Here's Chairman of the committee, Senator Cassidy, questioning Dr. Menarez.
Now, Secretary Kennedy told the Finance Committee that he did not ask you to pre-approve, but that you were biased against the new ACIP, and he just asked you to keep an open mind. Did he cite any data or science as relates to the potential ACIP recommendations to persuade you to support them?
He did not have any data or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
And so that was one of her main accusations, that RFK Jr. wanted her to approve the ACIP recommendations regardless of what those recommendations were. And here's more details on her other accusation. Here's Senator Andy Kim of New Jersey questioning Dr. Menarez.
Dr. Menarez, I wanted to just start with you. You were talking about how you were directed to fire career officials. I guess I just wanted to ask you, what was the plan? Who would have replaced them?
Yeah, part of what the secretary told me in the discussion related to those career officials was a sequencing of firing the leadership, promoting their deputies. If the deputies did not do what I had wanted, I needed to fire them, promote the next group, and continue to do so until I got to an organization that was compliant with my demands.
So the plan was to literally just kind of keep firing until there was somebody in that position that was willing to go along with what Secretary Kennedy was asking. Is that right?
That is what he communicated to me, yes.
I guess I wanted to just ask you, are you aware if this type of practice and this kind of order is given to other parts of HHS, FDA, NIH, any other parts?
He had said, although I have no means to verify this, that others at FDA, NIH, and CMS were engaging in this practice.
And the career scientists who remained at CDC, here's how she was expected to deal with them. Here's Senator Lisa Murkowski of Alaska talking to Dr. Menarez.
Dr. Menarez, were you ever directed to not speak to career officials? Was that a directive that you received?
That was.
And when was that? When were you directed to not speak to career officials?
Yeah, that transpired over the course of August 25th in the engagements with Secretary Kennedy, and that I was directed to only work with the political appointees that he had put in place at CDC, and not to speak or work with career scientists.
And Secretary Kennedy didn't even bother denying this one. Here's Senator Raphael Warnock of Georgia questioning RFK Jr. on September 4th in the Senate Finance Committee.
Did you demand that she fire career scientists or public experts at the CDC?
Yes. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.
And CDC staff isn't being cut only due to his firings. Others are resigning, and here's one of them. This is Deborah Horry. She is now the former chief medical officer at the CDC, and she was testifying in the same hearing as Dr. Menares.
3 weeks ago, I made one of the hardest decisions of my career. I resigned from CDC. I come to you as a doctor, as a scientist, and a mom. For over a decade, I worked as an emergency physician, treating patients where I saw firsthand how illness and death devastate families and loved ones, and even more devastating when it's preventable. That's what led to my career in public health. I changed my focus from treating individual patients to protecting the nation. I served 10 years at CDC, under 6 directors and 4 administrations. In each case, priorities shifted, but decisions were grounded in evidence, transparency, and consultation with the world's best scientists. That has changed. I resigned because CDC leaders were reduced to rubber stamps, supporting policies not based in science and putting American lives at risk. Secretary Kennedy censored CDC science, politicized its processes, and stripped leaders of independence. I could not, in good conscience, remain under those conditions.
And here's what she says is going on at CDC now. In this exchange, Dr. Horry is speaking with Senator Lisa Murkowski of Alaska.
I was the last career left in the office of the director. I have no doubt that my role will be replaced by a political.
May I stop you there? You're the last career. So then are you saying that everyone that is remaining
in the
is
office of the director is a political? Yes.
Is a political. And so there is nobody then that is, there must be somebody that is providing that career science then.
A level down, we do have center directors, although 80% are now acting because they've been fired, resigned, or retired.
And so let's take a closer look at an example within the CDC where there has been a mass firing by HHS Secretary Kennedy, the Advisory Committee on Immunization Practices, or ACIP. Here's Senator Susan Collins of Maine questioning former CDC Director Menares.
Secretary Kennedy replaced every single member of the advisory committee. Did he consult with you about any of the replacements?
No.
And here's what's happening since that mass replacement of advisors on the Advisory Committee on Immunization Practices. Here's the former Chief Medical Officer at CDC, Deborah Horry.
I first learned that the Secretary had changed our CDC COVID vaccine guidance on an ex-social media post. CDC scientists have still not seen the scientific data or justification for this change. That is not gold standard science. The Secretary's office ordered the removal from our website of the CDC scientific document on thimerosal, an additive to vaccines that science has shown is not linked to autism, while allowing an unvetted presentation on thimerosal to happen at ACIP, containing scientific assertions that were not assessed for data quality and bias. That kind of last-minute alteration undermines confidence in the deliberations that follow and is certainly not radical transparency.
And here is the situation on the day of the hearing on September 17th. Here's Senator Patty Murray of Washington questioning Dr. Monarez and then Dr. Ori.
The newly chosen ACIP members met in June, and they're going to meet again tomorrow. Will you, either of you, feel confident telling parents they can now trust the ACIP recommendations that come out of this week's meeting?
I'm very nervous about it. I don't know. They haven't met yet. I know that the medical community has raised concerns about whether or not, again, they have the commensurate backgrounds to be able to understand the data and the evidence and to evaluate it appropriately. I haven't prejudged. I don't know what will happen, but I certainly will be watching.
Dr. Hari?
I have significant concerns as the public hasn't been able to weigh in. The general vote should have been posted 2 weeks ago so the public knew what was being discussed other than high-level things. There haven't been work groups other than for COVID, and there haven't been, as of yesterday, the data hadn't been posted yet. So it's unclear to me what decisions are being made.
Dr. Monarez and Dr. Hari, I want to ask you both, are you aware of any scientific evidence to support changing the age of which children should get these vaccines that's being considered by this advisory committee? Dr. Monarez.
I am not. I was certainly open if there were scientific data sets or evidence associated with anything that would help keep our children safe. I was open to seeing it. I have not seen that data.
Dr. Hari?
Ditto. We've asked for the data and asked for the modeling to support any decision that is done.
Are either of you aware of any scientific evidence to support changing eligibility for COVID vaccinations?
I have not seen any evidence.
No.
And Senator Bill Cassidy, again, the Republican chairman of the committee, seemed to be concerned about the meeting that was going to happen the next day in the ACIP. Here he is talking to Deborah Ori, who was the chief medical director of the CDC.
Dr. Ori, Dr. Monarez has just said the secretary directed her to accept vaccine recommendations without seeing them and for which there is no science. Related to tomorrow's ACIP meeting, who decided what would be on the agenda?
So I don't have great visibility into that. I know the senior advisor and HHS counselor worked with our staff and the designated federal official and proposed items.
Okay, and who is the senior counselor?
The senior advisor is Stuart Burns, and the HHS counselor is Ren Archer.
And those are political appointees answerable to the secretary?
Yes.
Is that the way does normally the cabinet secretary or political staff set the agenda for a scientific meeting?
Not for the past decade. I was at CDC.
So this is the first time that's been the case?
Yes.
And so here's what happened on the following day in the ACIP meeting, with an agenda set by political staff and using mysterious science. For COVID-19 vaccines, the committee decided to continue recommending the vaccine for everyone over the age of 6, but instead of people being able to just get the vaccine, now we have to do so in partnership with a clinician. Now, not everyone in this country has access to a primary care doctor, and so this does create a barrier to access and opens the door to health insurance companies to deny coverage for vaccines that are not prescribed by a doctor, although they have so far promised to keep paying for the COVID vaccines through 2026. The ACIP also voted to remove a long-standing recommendation that the vaccine for measles, mumps, and rubella be combined with varicella vaccination, which is something that helps with chickenpox. But this combo of vaccines is known as the MMRV vaccine. Well, the committee stopped the recommendations that the combo be used for children between the ages of 1 and 4 years old. While removing that recommendation, they are allowing parents to have the option of the MMRV vaccine for that age group, and insurance is supposed to keep paying for it for now. Now, what's strange is that the committee also decided to wait to make any changes to the hepatitis B vaccine recommendations, which have been in effect since 1991. Before those recommendations went into effect in 1991, approximately 20,000 children contracted hepatitis B every year. Now that number is almost zero. And a lot of this hearing was dedicated to concerns about possible changes to the hepatitis B recommendations. And I decided to leave those conversations out since no change has yet been made, but this is something that we think is on the horizon. But I do think it's worth telling you that the hepatitis B vaccine was of particular interest to the Republican chair of the committee, Bill Cassidy. But knowing that the ACIP members were fired and replaced in June, I think this timeline for medical advice is useful. Here's Senator Patty Murray of Washington talking to first Susan Monarez, who was the fired CDC director, and then Deborah Ori, who was the chief medical officer until she resigned.
would you feel confident telling parents they could trust the recommendations of the advisory committee that were made back in April before they were fired?
Yeah, I would say that the individuals that were participating in April had the commensurate skill sets and background to be able to evaluate the decisions before them. The processes were regular in terms of using the evidence to recommend. There was working groups that substantiated the information. There was robust deliberation during the ACIP meeting. I would say that it comported to the standards where the Americans could trust them.
Dr. Harris?
Agree. The data was presented and the committee was filled with experts with experience.
And so this is not medical advice because I am a medical know-nothing. But for me, if I wanted medically sound advice from the Advisory Committee on Immunization Practices, or from the CDC for that matter, I would use the Wayback Machine to find out what the recommendations were in April 2025. If these women trust those recommendations, I will trust those recommendations. But after that, I think I'm a no. And I'm grateful to have this timeline to make my own decisions about what to trust. And I'm grateful to have this opportunity to share this information with you so that you can use it too. But most of the country doesn't know this. I didn't know any of this until I watched this hearing. And so here's what the experts think are going to be the consequences of Secretary Kennedy's decisions at Health and Human Services. Here is Senator Bernie Sanders of Vermont talking to fired CDC Director Susan Menares.
And what is your concern? What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
I believe preventable diseases will return. And I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
And here's Senator Sanders questioning Dr. Ori, the former chief medical officer at CDC.
What are if trust in vaccines is diminished, if moms do not take their kids in to get vaccines, older people don't get vaccines, what will that mean in terms of our ability to save lives if, God forbid, another pandemic takes place?
So we're already beginning to see that as we're seeing childhood vaccination rates decrease. For example, measles is down to about 92.8%. That leaves over 200,000 kids now at risk for measles. So we are at risk for measles outbreaks. And for the next type of pandemic, a novel pathogen, with some of the staff cuts we have faced, we have less ready responders, we have less visibility into global pathogens at this time as well.
And Senator Collins followed up on the measles part of that conversation.
Dr. Lowry, did HHS's response to the measles outbreak earlier this year differ from its response to other infectious disease outbreaks in your previous interactions with the department?
Yes, in several ways. First, I never briefed the secretary, as did the center director who oversaw measles never briefed the secretary. In an outbreak response, usually you would be briefing leadership. The second thing is he said things like vaccines had fetal parts, and I had to send a note to our leadership team to correct that misinformation. We were also asked to include things like budesonide and clarithromycin in our toolkits for physicians, and I couldn't allow that as there wasn't evidence for that and would result in harm.
And the problems go beyond measles.
Flu campaigns were halted despite 270 pediatric flu deaths last season, the highest non-pandemic total ever, with 90% of those children being under or unvaccinated. We also saw the highest number of measles cases in 30 years, with 2 children dying. Instead of promoting vaccines, the secretary spread misinformation and promoted unproven treatments. CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the Secretary, global flu sample submissions have dropped by 60% and COVID samples by 70%, leaving us with far less visibility into what's coming. At the same time, moving experts on birth defects and chronic disease out of CDC will fragment our response capacity. We learned during Zika and more recently with Oropouche that reproductive health expertise was essential in these complex infectious diseases causing birth defects. Due to the Secretary's actions, our nation is on track to see drastic increases in preventable diseases and declines in health.
And Senator John Hickenlooper followed up on that testimony.
In your testimony, you mentioned the CDC has seen a 60% decrease in flu samples and a 70% decrease in COVID samples. That's alarming. That's striking to me. What's the reduction? What's that attributed to?
So a lot of that is attributed to withdrawing from the World Health Organization. Many countries don't view us as the same level of partner. That's something that can be overcome, but it takes leadership to really proactively reestablish those partnerships so that we're not flying blind. We know what pathogens are out there.
So we've stopped cooperating with the world, and now we're flying partially blind on purpose. Congress needs to get involved here. And the good news is that, as this hearing proves, they're starting to. But the Trump administration is putting up roadblocks that Congress should be pissed about. Here's Senator Tammy Baldwin speaking to former CDC Director Menares.
Dr. Menares, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
And this was a fascinating exchange, showing that Republican senators are split on whether they respect their own power or if they are total lapdogs for Donald Trump. So first, you're going to hear questions from a new senator, Senator Ashley Moody of Florida. Now, no one voted for this woman. She was appointed by Governor Meatball Ron DeSantis of Florida as a replacement for Marco Rubio when he became Secretary of State. Unelected Senator Ashley Moody is a MAGA ding-dong who is one of the lawyers who tried to help Trump steal the 2020 election. And the first time she will face voters will be in November 2026 when she needs to run to keep her gifted seat. But she is a senator for now, and here she is questioning Dr. Menares and then Dr. Oury. And then she'll be interrupted by Republican Chairman Bill Cassidy, and you'll also hear from Senator Bernie Sanders.
Have you coordinated with Dr. Oury? Am I pronouncing that correctly? And I apologize if I'm not. Did you coordinate with her or anyone else that you worked with surrounding your leaving?
I did not coordinate with anyone surrounding my leaving. I was terminated abruptly.
So you had no advance plan to write an op-ed, do a public hearing. I noticed that you immediately called our chairman.
I had committed during my confirmation process several elements, including integrity, transparency, working with Congress.
But you had no advance plan with any colleagues?
I had no advance plan with any colleagues.
Dr. Oury, if there wasn't an advance plan, did you tell a reporter we agreed to do this together?
Myself, Dr. Jernigan, and Dr. Daskalakis.
Agreed to do this all together?
Once Dr. Menares was being terminated, the three of us knew that we could not remain given our ethical concerns and commitment to scientific integrity.
I just want to make a brief comment as my name was invoked. As the chairman of the committee with jurisdiction over the CDC that favorably reported Dr. Menares as CDC director, it is entirely appropriate for someone with oversight concerns to contact my office or me, or frankly, any of us. Upon receiving outreach from Dr. Menares, I contacted both the Secretary and the White House to inquire what was happening and to express concerns about what was alleged. As soon as the director was fired, the Help Committee began reviewing the situation as it is our responsibility, and any and all communications with the witnesses was conducted by Help staff in coordination with attorneys.
Mr. Chairman, may I comment on that, please?
Yes, sir.
Very briefly, I find it rather astounding that anyone is concerned that government heads of agencies talk to the elected officials of the United States of America. That is what they are supposed to do. Thank you.
And I think when it comes to Congress, more than anything, this is what we need to be combating right now. We need to identify and shame any member of Congress who is working as a mole for the Trump administration and who is diminishing their own power in MAGA servitude. Because Congress is our branch of government, and they are giving away our power when they do things like punish or admonish officials for reaching out to Congress. And this is especially damaging when public health officials are being in any way told to keep information from Congress and therefore the American people. And this concern isn't Trump derangement syndrome. Health officials from all administrations going back 50 years are sounding the alarm. On September 1st, there was a letter to the public that was published in the New York Times. And the authors, it was quite a long list. So the authors include Dr. William Foge. He was the director of the CDC during the Carter and Reagan administrations. There was Dr. William Roper, who was the CDC director during the Poppy Bush administration. There was Dr. David Satcher, who was the director of the CDC during the Clinton administration. There was Dr. Jeffrey Copeland, who was the director of the CDC during the Clinton and George W. Bush administrations. There was Dr. Richard Besser and Dr. Tom Frieden, who both served as director of the CDC during the Obama administration. There was Dr. Ann Schuchat, who served as the acting director of the CDC during the first Trump administration, and then there was Dr. Rochelle Walensky and Dr. Mandy Cohen, who both served as directors of the CDC during the Biden administration. All of them, going back to the Carter administration, together wrote a letter to us that said this, quote, "We have each had the honor and privilege of serving as director of the Centers for Disease Control and Prevention, either in a permanent or an acting capacity dating back to 1977. Collectively, we spent more than 100 years working at the CDC, the world's preeminent public health agency. We served under multiple Republican and Democratic administrations, every president from Jimmy Carter to Donald Trump, alongside thousands of dedicated staff members who shared our commitment to saving lives and improving health. What the Health and Human Services Secretary Robert F. Kennedy Jr. has done to the CDC and to our nation's public health system over the past several months, culminating in his decision to fire Susan Menares as CDC director days ago, is unlike anything we have ever seen at the agency and unlike anything our country has ever experienced. Mr. Kennedy has fired thousands of federal health workers and severely weakened programs designed to protect Americans from cancer, heart attacks, strokes, lead poisoning, injury, violence, and more. Amid the largest measles outbreak in the United States in a generation, he's focused on unproven treatments while downplaying vaccines. He canceled investments in promising medical research, and that will leave us ill-prepared for future health emergencies. He replaced experts on federal health advisory committees with unqualified individuals who share his dangerous and unscientific views. He announced the end of U.S. support for global vaccination programs that protect millions of children and keep Americans safe, citing flawed research and making inaccurate statements. And he championed federal legislation that will cause millions of people with health insurance through Medicaid to lose their coverage. Firing Dr. Menares, which led to the resignations of top CDC officials, adds considerable fuel to this raging fire. We are worried about the wide-ranging impact all of these decisions will have on America's health security. Residents of rural communities and people with disabilities will have even more limited access to health care. Families with low incomes who rely most heavily on community health clinics and support from state and local health departments will have fewer resources available to them. Children risk losing access to life-saving vaccines because of the cost. This is unacceptable, and it should alarm every American, regardless of political leanings." Unquote. Now, the good news is that this issue seems to be penetrating the Republican wall of protection around President Trump that exists at least in the Senate. In fact, there seems to be a crack in that wall in general starting to form in the Senate. There is a group of Republican senators who have already said no to Trump in official votes, Lisa Murkowski of Alaska, Rand Paul of Kentucky, Susan Collins of Maine, Tom Tillis of wherever Tom Tillis is from, and Mitch McConnell of Kentucky. And now we can add to the list Bill Cassidy of Louisiana, who has done some real oversight of a Trump administration decision. The cracks are forming, but it's up to us to bust them open. And this responsibility falls most upon those of us who live in states with Republican senators. Now, all Republicans need to be pressured to do their jobs in this Congress and conduct oversight and to punish criminal members of the Trump administration. But in the Senate, there are 53 Republicans. But like I just said, Murkowski, Paul, Collins, Tillis, McConnell, and Cassidy, that's 6 who have shown some measure of disapproval for Trump administration bullshit. And I know that more of them know that so much of what the Trump administration is doing is wrong. Like, I think Josh Hawley and John Cornyn and James Lankford and Chuck Grassley and Mike Lee, they have been statesmen sometimes. They just need the political courage to act on the concerns that I know that they have. And with Cassidy leading the way on the health issue, this might be one where we can make a difference with our congressional advocacy. And so call them, support Cassidy's investigations, and tell them we need more investigations. These members of Congress, they get negative calls all the time, so call them with praise along with your concerns. But let them know that we want and need more oversight. You know, Donald Trump gets support because Republicans, they think that voters love him. Members of Congress are political cowards. They support Trump's chaos because they fear his wrath. But I think that if voters are turning on Trump and his administration's recklessness, I think that members of Congress, Republican members of Congress, will eventually turn on him too. But we have to tell our members of Congress how we feel, to give them the confidence to do their oversight jobs, because the cracks are starting to form, and we can make those cracks bigger. And while the House has been missing for over a month, our senators are still at work. And so give them a buzz. The phone number is 202-224-3121. Calling can't hurt, but it could help. And we might as well try. All right, I'm wrapping up this episode for today because for the second episode in a row, I have no executive producers to announce. Like I said at the start of the show, our support is down, so please support the show if you can. And also, please share these episodes widely as I still have no marketing budget. But I would also like to thank Claire, who is my production and research assistant. She would also like me to let you know that at the CDC, they have also fired the librarians that help the CDC scientists who are left to do their research. Claire is a professional librarian. That's why she's so helpful for me with the research. And the librarians are what the CDC scientists use to collect information from all over the world and to get it translated into English. They do really important work and they are no longer on the job. So thank you, Claire, for the work that you do for us and for making us aware of that additional scandal at the CDC. I'd also like to thank the team at Pro Podcast Solutions for editing these shows. Thank you, Mark, at podcastbranding.co for doing our web design and security. Thank you to my sister, Lauren, for taking care of our executive producers when we have them. Thank you to my dad for doing my taxes. And thank you to Brian, who is our artist in heaven. And of course, thank you for listening and sharing the show. And I will talk to you soon.
We don't have a domestic spying program.
They're content to fight in black and white despite the many in-betweens. We got a president who plays with the facts. And then he waves a flag to cover his tracks. As if a lie is alright, in the end will justify the means. Now we are so damn tired of being lied to.
The polar ice caps aren't going away.
We don't think we can deny it anymore. You can stick to your story if you think it lies. But we're not keeping quiet anymore.
Government jobs consume the profits of the private sector.
We don't think we can deny it anymore. You can stick to your story if you think it flies. But we're not keeping quiet anymore. Now we're not keeping quiet.
These bills represent common sense, bipartisan solutions that actually solve problems.